And we're live, Geeks and Gains gang. Thank you for tuning in. With just the modicum of success that I had in my previous video, I want to go ahead and touch on what I think is an even more pressing and important issue that I think should have attention way more so than the GameStop controversy. So let's talk about the pandemic. So far, there have been over 400,000 lives lost in the United States due to the SARS-CoV-2 COVID-19 spread. And we are currently about to go into phase 2 here in Washington State. And in Washington State, we were one of, if not the first, we were the first documented place and one of the first places, if not the first place, that the COVID-19 vaccine, that the COVID-19 infection got here from Wuhan, China. And I was recently listening to a podcast with Lex Friedman in which he had a scientist, Michael Mina from Harvard University, who came in and was talking about policy. Now, I've been studying policy since I was 15 years old. I did policy debate for 7 years, rocking my Cameron's Forensic National All-American sweatshirt. And so let's talk a little bit about policy. Right now, one of the main issues for tracing and understanding the spread has to deal with R naught. So if you're not familiar with what R naught, it's like R with a little circle at the bottom of it, NAUGHT, R naught, is a value that can be calculated for communicable diseases. It represents, on average, the number of people that a single infected person can be expected to transmit that disease to. In other words, it's a calculation that averages the spreadability of infectious disease. Well, why is it useful? According to Harvard Global Health Institute Online, R naught provides valuable insight into the potential spread of disease that local, state, and national governments, as well as public health authorities, can use to factor into their decision-making to best control the outbreak. Also, since it can be calculated for various diseases, it allows us to contextualize an outbreak with ones that have seen previously, such as SARS, MERS, Ebola, AIDS, seasonal flu, and the 2009 H1N1 flu pandemic. Now, the thing about SARS-CoV-2 is that it's a novel coronavirus, which means that we have no pre-existing immunity to it. And right now, the top of the line testing, for anyone who's had to go and get a test, there are oftentimes long wait lines. Sometimes you have to wait in your car, and very likely you don't get results 3, 4, sometimes 5 to 7 days. And when you have a high R naught or an R naught above 1, we start seeing logarithmic or exponential growth. Now, that thing in algebra that you never cared about and never thought would be important, turns out it's actually extremely important when you're looking to analyze and understand logarithmic growth, in which you have an exponential growth when you have an R naught that's higher than 1. And so the amount of people that can infect other people and have an exponential growth is extremely important to understand. And so if people are sitting around for 5 or 7 days and they don't know if they're infectious or not, or they happen to be asymptomatic and they don't go and get tested, but they're still a carrier, that increases the volatility and the pervasiveness. It also allows for the spread, which has now led to even more virulent strains that are even more transmissible and will have a higher R naught value. We don't know what those are yet because this information, there's apparently a new UK strain and a South African strain, different strains that develop in different parts of the world that are going to have different R naught factors, but they seem to spread more, not less. And let's just be honest here. The infrastructure of the rollout of vaccinations in the United States has been abysmal. It's been, I don't want to say a complete failure, but there's been oftentimes needs have gone unmet. You have to go in by what your work qualifications are, where you work, what you do. They've turned people away. I was listening to NPR today about reports of individuals who were supposed to give out these shots to elderly and people of color and minority groups, and ended up not giving all of them away and taking them home themselves. There's a surprise. Again, another form of not crappy, but crony capitalism wreaking itself in which the haves and have-nots have disparate outcomes. But let's get to some solutions, okay? Because if there's one thing that this administration, this world, everyone needs right now is we need solutions, not just talking heads talking about how bad it is and how much everything sucks. So here's some actual very simple policy. Again, the title of this video is how we could stop the spread of the pandemic by April Fools, and that's no joke. Now, Mr. Mina, who I referenced previously, went on Alex Friedman podcast and was talking about rapid antigen testing. And you can actually go to rapidtests.org and get lots of information. But essentially, rapid, inexpensive antigen tests that can be done with the swab of the mouth or typically the nose, and it's not the super invasive one that has to go back in the nasal cavity, can detect cases that would otherwise be missed, allowing people to isolate before they infect. Research shows that if used frequently, these tests could significantly drive down infections. And so essentially, we're taking that R naught number and bringing it down below the current rate of which it's at. So even if there is spreading, it spreads to just several people as opposed to dozens and dozens of people because of early detection. Over 15 leading scientists and infection disease physicians agree to control the virus and help reopen schools. We need millions of these tests per day. And the fact of the matter is, other countries are already doing this. There are other European countries that are already ahead of the game here. Rapid tests could be deployed now and are available without a prescription, so we don't have to wait months for a vaccine to arrive. Because they return results within minutes, rapid tests are ideal for routine public health screening. They're also great for private at-home use, similar to a pregnancy tests. Now, rapid tests, they're not perfect. They can't detect every case, but they would be an instrumental tool, and they're good at detecting when you have enough of the virus to be contagious. And that's what we care about. We don't care about perfection. We care about what's known as risk mitigation. Okay, so we have a risk. Life is not without risks. You walk out the door every day, there's a risk. So how do we mitigate the risks? We put on our seatbelts. We drive the speed limit. We follow the law. We do all kinds of things. We put on helmets when we ride bikes. We do lots of things to still take risks as free Americans, but we mitigate those risks for the betterment of all mankind. So the big question, what really grinds my gears? Why aren't we funding this? Well, the reason that we aren't doing this in the debate community, we call this the inherent barrier. What is preventing us from getting our plan into action? And the fact is that one of the main roadblocks comes from the FDA, because rapid tests have faced regulatory roadblocks. While some have been approved, they typically require a prescription, which is not necessary because it's not a medical device, and often not approved for asymptomatic use, which means if I don't have symptoms, no one's going to write me a prescription for it. These things need to be like aspirin. They need to be millions and millions available at Walmart tomorrow. We have the infrastructure. We have the will. I'm certain, if Elon Musk got a wild hair, he could have these up and running in hundreds of millions tomorrow. The engineering and scientific community is ready and able, and this could happen. It's a legal and intrinsic educational background. We need to have people educated on how to run these tests. They're very simple. You can see them online. So we need to have basic public health information to show people how to do these. Businesses could have them. You could have them before you go into a gym. You could have them before you go into bars, and boom, right away. There's a potential, even for false positives, if you go and get more exact tests later, you have decreased the R naught, which is the whole game. That's the whole game, is we want to prevent future spreads. And we could do it by rapid testing at home. We could do these before, everyone could do these before they go out. Particularly kids. These would be perfect for young kids because young kids tend to be asymptomatic and they seem to have the highest R naught values, transmitting to intergenerational transmissions that happen from the youngest to the parents to the grandparents, which has been a very hard time for us. So these rapid tests need to be implemented. Why aren't we funding this? Let's get on it. Let's stop with the nonsense. Let's see some results and let's take some action. Okay. Let's do something right now that doesn't require massive amounts of science and ingenuity. And it's things that we can do right now. They're not going to cost hundreds of billions of dollars. We could get millions of these things out the door tomorrow, and we could severely reduce the R naught value, which would, in essence, it's like the seasonal flu. It's never probably going to go away for good, but we could prevent the transmission and get back to, a regular state of being in a very short amount of time. So today we're focusing on what is the R naught transmissibility rate, and how do we affect it? What can we do? Washing your hands reduces the R naught. Wearing a mask reduces the R naught. Social distancing reduces the R naught. Rapid testing will reduce the R naught. Get on it, internet. Let's do it. Let's get this done. Everyone should have one of these tests.